Hello friends, I am Dr. Nirupam Sharan. On behalf of HIPPOCAMPUS by MedEasy, I am here to introduce you to new pattern of clinical examination known as Oski. Oski is a type of examination which evaluates students, particularly the medical students, clinical skill and how they perform those clinical skill in different areas of assessment. You may be given a clinical history, you may be given a procedure to do, you may be given a radiological picture to evaluate and different clinical scenarios. So you will evaluate it according to the given parameters. Oski means Objective Structured Clinical Examination. According to DNB notification, there will be a 25-station Oski examination. Each station will carry 8 marks and you will be given 5 minutes each. So total of 200 marks, and at the end you will have a viva of 40 marks. This is the notification by National Board of Examination which says day 1 will consist of observed structured clinical examination. On first instance, it looks like a typing error, but no, it is deliberately done. Instead of objective, they have replaced it with observed. So you will have a observer, either virtual or real one. What is an Oski? It is a standardized scoring tool which records what a examinee is doing or what he or she is not doing well. And then examiner uses a checklist to evaluate the examinee. Why it is structured? Because each candidate experiences the same problem and perform the same task in given time frame, and he or she is exposed to same difficulty level. And as the name suggests, it is clinical because it represents same clinical real life scenario. Examination enables a reliable assessment of candidates' clinical skill and knowledge. Oski is meant to test the level of Miller's pyramid. As you know, if you have knowledge, you know about that particular subject, that particular station. If you have the knowledge, you will have the competency of performing that particular station clinical scenario or particular task, whatever they will give you in that particular station. If you are competent, you will perform, and your performance is reflected in your deeds. So your action. So if your action depends upon your performance, performance comes from competency, competency comes from your core clinical knowledge. So nothing to worry about Oski. It can be blessing in disguise. During Oski examination pattern, the bias is very less. You will be asked similar type of questions, similar time, similar pattern, similar checklist, and you have to answer it. Basically, they will be checking your clinical skill, your history taking skill, your performance skill, your communication skill, your statistical skill, station setup. Once the examination begins, there will be no break. So be prepared. Each candidate is pre-assigned to start at a specific station. All candidates will be rotated through all stations. Suppose there are 25 stations. So total number of candidates in that group will be less than 25. And each candidate will be assigned different stations simultaneously, and they will start simultaneously. And each and everyone will be given same challenge, same time. This is by way of animation. We will try to explain you. Suppose these are the students. Once they perform or finishes their particular station or time is up, they will move to next station. This is the Oski station setup. This is the basic setup. Suppose student A is at 1, B is at 2, C is at 3, D is at 4. Once the A completes 1, A will move to 2, B will move to 3, C will move to 4, and D will move to 5, and so on. So each and everyone will go around the same set of question, and each and everyone will complete all the station. And on the bottom is they can modify this basic system into a linked one. Suppose station 1 is about a clinical scenario which asks you what type of fever it is. Once you answer type of fever, the linked question will be management of that type of fever. Suppose you are not able to answer the type of fever, automatically this station 2 you cannot answer, because once you cannot identify this, you will be not able to answer the management of that type of fever. So sometime it will be not so much linked. Suppose you will be asked to demonstrate Allen's test. Allen's test is test to check the patency and collateral of radial artery before ABG. So once you perform Allen's test, they will ask you to demonstrate the step of ABG. After that, they will ask you at station 3 to interpret an ABG. So it will be like that. So nothing to worry about that. This is just to make you familiar about what Oski and what is the pattern of Oski station setup. This is a Oski station setup. Everyone will be given a different station, and it will be concealed one, so you cannot peep into other station. And this is just to make you familiar about how it looks like. This is another example. Everyone will be given different station, and once you complete your station, you will be moving to the next station. This is the Oski station. It can be observed. This is just a prediction. You may have a 5 to 6 observed station, and 19 to 20 unobserved station, or anything. This is just a prediction. In observed station, examiner will be present on the spot and observing what you are doing, and according to the checklist, he will be marking you. You can be asked to take a clinical history, like history of a fever. Then he may ask you to perform an examination of percussion, or he will ask you to perform a procedure like CPR, lumbar puncture. Then the examiner may ask you to perform a counseling of a bad news to the patient, or they will check your communication skills.